If you're suffering from knee pain, there's a few things to think about. It may be a genuine knee problem, or it could be coming from somewhere else. If you've been walking with your weight on one side for some reason, you may have a foot injury or something, or if you've obviously had trauma to the knee, it could be the knee repairing itself. You might have torn some ligaments, micro tears or gross tears, and the muscles might be involved as well. Or you might have something worse like an arthritic condition that's attacking the knee, or it could be an infection in the knee. So all these things need to be checked for by a qualified health professional. But if it's not any of these, they just ache, and you've had maybe a scan or x-ray and there's not much going on there, you tend to be pulling your hair out then. But what you have to consider is it could be coming from your back. The thing about knees is they are being bashed around all the time with daily living, and they constantly heal up. So it's a constant battle. Now the healing comes from the base of your spine, because those nerves from there, they go straight to the knee and they do the healing. If those nerves aren't getting a clear path because you have a back problem, those things won't happen. And a lot of back sufferers find their knees just ache all the time. Sometimes people come in saying, my knees are aching, but my back's fine. But when you check the back, it's far from fine, it just isn't hurting. So that can be the case as well. So have it all checked and find out the cause and fix it. Knees are the slowest healing joint in the body because they've got the least amount of blood going into them for the size of the joint. So they're very slow. I damaged my knee ligaments a couple of years ago. I tore the medial collateral ligament and the meniscus, and that was an almighty pain. And I got the scan done, and it was about 2/3 torn with the 1/3 hanging on. So I thought, well, it's going to grow back. So I didn't do any surgery. I just kept exercising it, took lots of supplements, and slowly, gradually it grew back. It took about 20 weeks, which is a long time when you're hobbling about. But now it's fine. I can do anything. I wouldn't play football now, because if someone smashed into me and broke it again, I'd have to kill them. But I'll play football with the kids because they're kind of small. So that's my story. Some people are waiting for a knee replacement because the knees are worn and they're badly worn and they need replacing. I wouldn't rush into a replacement because we try and keep people going as long as they can before, because a replacement joint is not a new knee, it's an artificial knee, and it's not as good and it doesn't last forever. So if you put it off till later, sometimes with hips and knees, it's best to do them at the latest possible time so that they last you right into old age. The other thing, of course, is you might find when you meet certain people, you go weak at the knees, but that would be completely outside of my scope of practice. Good luck with the knees.